I was getting ready for my wedding. I was preparing for my bridal shower, and I noticed I was short of breath. I had a little heaviness in my chest, and I felt like I had a lot of fatigue. But we thought it was the wedding jitters, and we thought that it was something that would pass. The heaviness in my chest, I felt like someone was sitting on me. So I'd been walking around for more than 3 weeks in heart failure.
I awoke to stuttering, and my equilibrium was totally off, and I knew something was wrong. However, I didn't do anything about it. Later on that day, they found me in the bathroom passed out, and it was at that point I was hospitalized, and the doctors informed me that I'd had a mini stroke. But the reason I had a stroke was because I had heart disease.
The leading cause of death for women in the United States is cardiovascular disease, and that includes congestive heart failure. There are several causes of heart failure in women, and they tend to occur at various times in life. There is a congestive heart failure that can develop during pregnancy or early after pregnancy. Another cause, the common cause of heart failure is myocardial infarction or heart attack. That can happen at any time of life to a woman. But later on in life, as a result of high blood pressure through the years, women can develop heart failure, which is related to thickening of the heart muscle. These women are generally older, and they're often underdiagnosed because they believe that at this time of life they should be fatigued, tired, short of breath, and that is often a group of women who are not diagnosed early with congestive heart failure when they could be.
I had to educate myself because I knew very little. I knew about heart disease because I'm a heart patient. I knew nothing about heart failure.
Damage to the heart muscle that results in congestive heart failure is generally a very global process. All chambers of the heart are affected, but sometimes the left-sided chambers of the heart are affected more than the right, and sometimes vice versa.
My right lung was completely full, and my left lung was almost half full. I always felt like I had a third person on me, like I was carrying somebody. Who would be laying at a table with pillows and sleeping and think that that's normal? But you think it's going to pass. I could not even shower by myself. It was hard. I couldn't breathe.
Sometimes heart failure can be very insidious, but the majority of people who develop congestive heart failure develop it over a period of days to weeks to months, and they may not fully understand that the symptoms are abnormal. Any kind of symptom such as fatigue, shortness of breath, chest discomfort, abdominal fullness, swelling in the legs, or sometimes even the hands, signals a change for which you should talk to your doctor. The most common causes of heart failure in the United States are coronary artery disease and hypertension. Patients with coronary artery disease often have had a myocardial infarction or a heart attack before developing heart failure. Other causes of heart failure include valvular heart disease, both leakage of heart valves and also narrowing of heart valves. And then we have causes that involve toxic substances such as chemotherapy for cancer, and then either illicit substances like drugs or even alcohol, when used in excess, can cause heart failure.
When my doctor and I sat and talked about what type of treatments that we were going to work with, I always like to know all my facts before I even get started. He was very concerned when I first came in and I was diagnosed. Biggest thing was to get the fluid off my chest, and then from there we would go.
The most important message about treatment of heart failure is that treatment of heart failure can restore heart function. And medications alone are sometimes the only therapy needed. Medications have really revolutionized the treatment of congestive heart failure in the last 2 decades. These medications can change the process that is result in abnormal heart function that is called remodeling and restore heart function. And oftentimes with good medical therapy, cardiac function can be restored to normal. The majority of cases of heart failure can be prevented because the majority of heart failure is caused by high blood pressure, diabetes, high blood cholesterol, obesity, and smoking, which lead to cardiovascular disease. There are causes that are not preventable. In each of those cases, though, good treatment can result in great outcomes. The same things that we bring to prevention, such as keeping blood pressure under control, modifying risk factors, will improve heart failure outcomes.
It's a battle. There's a ton of fatigue, which I live with. When you get excited or anxious, that takes energy. If you're cold, that takes energy, and it's all a piece of it. Talking takes energy. It's the little things that are hard. So I balance. I try to look at what I can do, and if I have something big, I try to prepare for it.
Any patient with heart failure, just like any patient with any kind of heart disease, needs to quit smoking. And diet and exercise are very important. What is crucial in heart failure is the avoidance of high sodium foods. We advise patients to take in no more than 2,000 milligrams of sodium a day. That is a major lifestyle change for a lot of people, especially in the United States. Exercise is important as well. Many, many years ago, we told heart failure patients to go to bed and rest. That is no longer the case. Recording your weight daily is very important for patients with congestive heart failure because subtle changes in fluid balance can become evident with a change in weight. So we instruct patients to not only weigh themselves, but to notify us of a sudden change in weight, such as 3 pounds overnight, 5 pounds over 2 days.
Right now, I'm living. I don't let my condition stop my progress or stop me from doing the things I love to do. There's still life in this body, and I can still be a message for someone.
Cardiovascular disease and heart failure are hard diagnoses to be given and to own. But I think it's important for women to understand that they can survive this disease as well. It is a chronic disease, but with good treatment, long-term outcomes can be very good, and they should feel like they're survivors.
A lot of times there's a lot of people that think that once you go to the doctors, they're going to give you something and you're going to move on your way and it's going to be gone and it's going to be over with. You live with this disease every single day of your life. It's never gone, and there is not one pill that's going to fix it. There's not one exercise program that's going to fix it. There's not one diet that's going to fix it. What there is there's you managing your weight, you managing your diet, you managing and ensuring that you're taking all your medicines appropriately, accurately, timely. All these things, it's you. It's your responsibility.